Hi everyone, my name's Esma. I'm an ST3 Obs and Gynae trainee in the West Midlands Deanery, currently working in Midlands Metropolitan Hospital with a special interest in endometriosis. Today I'm going to be talking about the mental health burden and quality of life impairment at first presentation to a BSG endometriosis centre. So we know that endometriosis is associated with chronic pelvic pain and psychological distress. However, we primarily focus on the pain aspect of the condition and often put aside the mental health element of the disease. As a result, mental health assessment remains underintegrated in endometriosis pathways. There have been multiple studies that have shown that patients with endometriosis have high rates of depression and anxiety and an impairment in quality of life, and that these are mainly linked and closely associated with pain severity. When we look at the literature regarding the impact of psychological intervention, it's actually very promising. So, for example, Henson et al. Found that psychological intervention improves quality of life even without reducing the pain. And Donati et al. Found that cognitive behavioral therapy leads to reduced depression and stress levels, as well as improving quality of life. And it also, interestingly, reduces pain perception and helps with coping. Based on this, we decided to evaluate the prevalence of depression, anxiety, and the quality of life impairment at first presentations in our BSG accredited endometriosis centre. And we also examined the relationship between mental health severity and quality of life. This was a retrospective cross-sectional analysis using the BSG questionnaire. We collected data from January 2023 until December 2025 with a total of 1,439 responses, 960 of which were first attendees, and they were our target cohort. Mental health was assessed using the PHQ-9 for depression and the GAD-7 questionnaire for anxiety. And quality of assessment was also assessed over 5 domains. This is a photo demonstrating the PHQ-9 and the GAD-7 scoring scale, both of which show that an increase in score suggests more severity of the symptoms. Quality of life was also measured under 5 domains, which include pain and discomfort, ability to carry out usual activities, self-care, mobility, as well as anxiety and depression. 30% of the patients presenting for the first time in our clinic had moderately severe or severe depression, and 22% of them have severe anxiety, both of which are clinically significant, requiring psychological intervention. When we break down the different domains in quality of life, up to 90% of the patients had problems with pain. However, the graph also demonstrates that endometriosis is associated with multi-domain quality of life impairment. And this reflects both the physical and functional consequences of the disease. When we look at the impact of depression on quality of life, it is evident that there is a stepwise increase, with more severe depression causing a worsening of the quality of life. And this reinforces the importance of early identification in these patients and ensuring that it's part of management. Anxiety also shows a similar pattern to depression, with patients who suffer from severe anxiety also having a worsening quality of life. Interestingly, when we compare the severity, there's a 2.5 greater impairment in quality of life in those with severe symptoms compared to those with mild symptoms. In conclusion, the results support the fact that mental health is a burden and a key determinant of quality improvements in endometriosis patients. It also supports that there should be routine psychological screening embedded into the endometriosis programs, and it reinforces the need for integrated multidisciplinary care from first presentation. These results will also help us in the future, allow us to recognize the psychological burden in these patients, make sure that we have enhanced MDT recognition and integration in our services, which include clinical psychology services. And it can also provide evidence to support funding in our endometriosis centre for a nurse-led wellbeing clinic. This study can also be the foundation for future projects. For example, it can allow us to assess the changes in quality of life of our patients over time, seeing do their symptoms improve with treatment, helping us identify responders versus non-responders. It could also may potentially be used in the future as a predictor of poor outcomes, helping us identify which patients are high risk. For example, if a patient has a higher quality of life impairment score or persistent symptoms, this can be correlated with a response to the medication and management.